Welcome to Nurse to Health, the podcast where we take you behind the scenes and to the front lines of healthcare and healthcare education. Nurse to Health is brought to you from the studios of WRHU at Hofstra University in collaboration with the Hofstra-Northwell School of Nursing and Physician Assistant Studies. I'm Dr. Bob Gluck.
And I'm Dr. Kareem Nagdallah. Today, we're delighted and honored to be joined by Dr. Kristy Loewenstein, Dean of the Hofstra-Northwell School of Nursing and Physician Assistant Studies, to explore where nursing and nursing education is heading and how students are being prepared to serve the needs of patients in a very dynamic healthcare environment. Thank you for joining us.
Of course. Thank you.
Let's just start with a little bit about you.
I've been a nurse for 27 years. The vast majority of that has been in psychiatric nursing. I took a bit of a circuitous road to where I am now. I started out as a pre-med major when I graduated from high school, and that was what I was going to do. I was a biology major, and I was going to go to med school. You know, you go to college and decide different things. You know, you want to do different things, and I changed and decided that I wanted to go to nursing school. So I went to an associate degree program, Catholic Medical Center of Brooklyn and Queens, and then I actually went right into a bachelor's program at Stony Brook. When you're 22 and you get a job and you have a real salary for the first time and start working, school doesn't seem as important. So I did take a lot of time off. I took 10 years off before I went back and finished my bachelor's degree. During those 10 years, first year after nursing school, I did a bunch of different jobs, nursing home, substituted as a school nurse. I worked in a group home, as the nurse where I'd been working as a direct care counselor. But I knew I wanted to work in psychiatry. I truly loved my psychiatric rotation in nursing school, and I knew that's what I wanted to do. I was working with developmentally disabled patients who often wind up hospitalized in psychiatric hospitals. So again, another population that I really like to work with. So I got a per diem job at Zucker Hillside Hospital and a full-time job at Brunswick, which is still there, Brunswick Hall Psychiatric Hospital. So I worked primarily with developmentally disabled patients and with children and adolescents who had mental health disorders. And I did that for about 10 years. Eventually, I gave up Brunswick and I wound up full-time at Northwell. My units changed through a variety of different psychiatric populations. One day, I was on my unit and the nurse educator came over to talk to me. And she said, one of the educators is leaving and my husband is really sick and I have to take a leave of absence. And so we need somebody to run this department while I'm out. And you're very smart. You always make cogent arguments and you're a great clinical nurse. And so that's what happens to clinicians, right? You do a great job and they're like, well, try this out. So I got plucked to go into the education department. So I was working in education and, realized at that point, well, I really need to go back and finish and get my bachelor's degree and my master's degree. So that's what I did. I started as a staff educator. I finished. I got my bachelor's degree. I got my master's as a psychiatric nurse practitioner. And then I was promoted to director of nursing education for the department at Zucker. And I got to take advantage of a lot of different things from Northwell. Wow. I was in the high potential program. So, I've gotten a lot from Northwell Health in my career. The luckiest part probably being I was named one of the Robert Wood Johnson Foundation Future of Nursing Scholars from Northwell. So I was able to complete my PhD, which I did at Medical University of South Carolina, and I was fully funded for it through the Robert Wood Johnson Foundation, Northwell Health, and MUSA. I'm very grateful, certainly.
Let me just make one point. We don't have time. We have so much to talk about here. We don't have time to really dive into the psychiatric part of things, but needless to say, that's a really important topic. So we're going to actually have you come back.
Absolutely.
So all our listeners, look out for that. We'll have you come back. We'll do another whole session just on psychiatric stuff. But just maybe sort of define what you cover in the world of psychiatric nursing. What does that encompass?
It encompasses everything. And honestly, all nurses should be psychiatric nurses at some point in your career because you will see my patients wherever you are. Psychiatric patients get sick all of the time and wind up in medical hospitals, and people have difficulty caring for them a lot of times because of their behaviors. But they're an extremely vulnerable population, a population that a lot of people don't like to necessarily work with or have the patience or wherewithal to actually work with, and unfortunately often stigmatized and, taken advantage of. And that's changing in the field. Every day that changes, and our new generation is really open and mental health isn't as stigmatized to them. It is still stigmatized, though. So while it's improving, especially with our Gen Alpha and our younger, students, our younger patients, younger people, it still is often very stigmatized. And so people don't want to work in the field. And unfortunately, a lot of times when people are ill and they're not taking their medications, their symptoms do sometimes include, violence or violent outbursts. So that can be a little scary for people. Nursing students, PA students are always scared when they go into that psychiatric rotation, especially our undergrad students. That was one of the first things I did was clinical adjunct for a different university. But that was, one of the first things I did in terms of academia. And I used to take the undergrad students into the clinical area. And it was funny because they stick side by side, that first day, like they don't want to leave it.
Strength in numbers.
Exactly. Strength in numbers. Usually by the end of their 6 or 8 or 12-week rotation, whatever the case may be, my goal was to create new employees for myself. So I wanted them to truly, truly love their experience so that when they graduated, it was something that they would consider because it's not something that everyone considered.
You're the dean of the School of Nursing, Physician Assistant Studies. I guess it goes without saying, maybe not, that there's tremendous stress involved with training for a healthcare career. And then on the other side, post-graduation, it doesn't get any easier. I mean, the burnout rates and the issues are huge. And again, we'll have to have another whole
That could be a whole separate
session to deal with that.
Kristy, you kind of gave us a little bit of your background. I actually didn't realize how much of nursing education that you actually did. That's very interesting. Can you talk to us about the transition now to academic leadership?
From clinical to academia,
how's that for you?
Interesting, right? I wasn't sure really what to expect when I moved over into a leadership position in academia. Certainly I've been at universities and attended universities. I think the background as Deputy Chief Nursing Officer at South Oaks Hospital certainly helps. I've had successive leadership roles in my career at Northwell Health, and I think that's, what is helping me to be successful in the role as dean. Because, yes, I'm a clinician and I know nursing and I could teach nursing. In this role, it's about leadership. And what do you need from leaders? Leaders are really here to, in essence, make the job of the faculty easier. Healthcare, sometimes we talk about, or anywhere really, servant leadership or transformational leadership. And that's, I think, what you're looking for from, in general at the university, right? From our deans, from our leaders, or people that are going to support the students and the faculty, that are going to support the faculty with the innovative ideas that they have, or innovative pedagogies. How are we teaching our students? How are we engaging them? How are we making sure that they're prepared not just to pass their boards and pass a test, but to actually be able to take care of patients when they're on the front line? And so I think I have a good perspective because being the director of nursing education, I would get new nurses, the new graduates, to come to orientation, and you see, what it is that they're lacking, what it is that they need. So now I'm in a position where I can actually influence that. So, I think that is something that is going to be helpful moving forward.
Well, you had some of this skill set before, no doubt. I mean, that's why they picked you. But now you have a whole different cast of characters, right? What's been the biggest surprise, biggest challenges for you to this point? I'm sure there's more out there, but...
Yeah, I mean, the biggest surprise is just, it's a different pace, I guess is the right word. It's different than being in the clinical area. I mean, you both know, as working in the hospital, it's a nonstop, from the second you get into the morning until, 8, 10, 12 hours later, it's a nonstop pace, and you're constantly busy. There's always somewhere where you have to be, or something that you have to do, or a meeting that you have to go to, or a patient that you need to take care of, or an emergency that happens. It's a constant, something. It's not like that in the university. For someone like me, who's used to that very fast pace, it certainly is a little bit of getting used to, a bit of a slower pace, in terms of that. There's no patients to take care of, right? There's no actual blazing fires to put out or weekend staffing emergencies. Certainly that's been a nice change for me. I'm just trying to think the difference, and it really depends on which group we're talking about. Our undergrads, most of our undergrads especially are coming from high school. So, you have younger students who need to be taught in a different way than our grad students, our NP and our PA students, right? Who have a bit more life experience, frame of reference, being able to pivot in how you're working with those different groups of people. Our faculty are, for the most part, all doctorally prepared. So I really have high expectations of our faculty, just like I would of leaders doctors who work for me in the hospital. I really think that since I've been here, I've seen really positive changes in the school. I think it's become really cohesive, much more cohesive between our nursing and our PA and our perfusion departments, which is something that I really like to see because I'm a huge proponent of interprofessional education.
Can we dive into that for a second? The average listener out there is not going to really be savvy about what we're talking about. I mean, we sort of offhandedly talk about it as a school of nursing, but it's not, right? The official name is, it's abbreviated SONPA, S-O-N-P-A, right? School of Nursing and Physician Assistant Studies, but it's actually even more than that, right? There's a lot of moving parts. We have a perfusion program that's one of only a couple of dozen
20.
in
One of
right,
20
in the
in the
whole
country.
There's only 2 in all of New York State, ours and upstate. So there's a lot of moving parts, and I'll just mention, again, we'll talk about coming attractions. We're going to have another whole session, in fact, more than one, with the physician assistant leadership. Talk about that dynamic, because there is a dynamic there, right?
So, yeah, interesting. When I started, one of the things I did on my first couple days here was to stop over into the PA program. We're not all in the same building, unfortunately. So I went over to make a point of visiting and walking through, because, it is the School of Nursing and Physician Assistant Studies, and we want to make sure that we are working together as a team and that everybody really feels like that. Coming from the world of psychiatry, where we always joke that we're the redheaded stepchild of the health system, and it's not just us. People say that about psychiatry everywhere. I know how they feel, and so we want to make sure that they feel like they are a part of the team. I think, and you probably both know, right, being a nurse practitioner and a physician, that there's always been this sort of headbutting between nurse practitioners and PAs. They're both advanced clinical providers, there's which is better than the other. I mean, listen,
we all have our egos. Right?
Yeah, exactly. I mean, I could even talking about it from a personal patient level. I've seen both. No offense, Bob, because I know you're the physician, but I love PAs and I love nurse practitioners. I really like to receive care from ACPs.
I love everybody. Yeah.
Just like they say, nursing eats their young. PAs and NPs don't get along. I really don't think that that's accurate or true. And so one of the things that we're looking to do is really bring them together in the learning environment, because when they graduate, they are going to have to communicate and work together. And that's one of the things that it's always been very important at Northwell. Interprofessional education is something that we've been doing there for decades with the Center for Learning and Innovation and the Patient Safety Institute. Our simulation center here at the Science and Innovation Center really is a bit of a replica of that simulation center that we have at Northwell. Our goal is to get, going forward, our students in simulations together. Right now, it's a bit siloed. Undergrads are together. The NPs, maybe from different programs, will do some sims together. Perfusion has their own room downstairs. CRNA has their own room downstairs. PA is over in, Gallon Wing. But I think they can all work together, because in real life, when there is an emergency, right, they're all going to be in that room together taking care of that patient, and they're going to need to communicate. So if we can start that now, I think that we're just going to create better clinicians in the future.
To give credit to Hofstra University at large, right? I mean, this is part of the Hofstra 100 long-range plan. Strategic plan, because frankly, it's one of these things that just makes sense, right? I mean, we sort of want to condition and train our future healthcare providers, from all perspectives, to sort of buy into that.
Yeah. It's interesting that you bring that up about the nurse practitioners and physician assistants, because if you look at the training, I think the NP program really has adapted to a quote-unquote brave new world. They're doing a lot of nuanced things like pearls, and we are doing the simulation, but how can we bridge that gap here? Maybe having a joint course between the two programs, or what would that look like exactly?
So let me just interrupt before you answer. Sorry, because you mentioned pearls, which is one of those things we take for granted. Maybe, Kareem, just define that for our listening audience.
So pearls is a learning pedagogy. It's sort of like a flipped classroom approach where the professor becomes a facilitator, and they facilitate a small group, case-based learning. A long story short, it's a weekly basis. During that week, the first day of the week, they define their learning objectives. After defining their learning objectives, they go home, they research that, and they come back the next week and they report out. So if they get a cardiology case, maybe they'll go home and make learning objectives for cardiac stuff. If they get a pulmonary case, they'll do the pulmonary case and they'll come back and report. It's different, right? It's not really where you're just standing in front of the classroom and you're giving a lecture and the students are just kind of like learning in that way. The students really are responsible for their own learning. So I know, like, if I'm thinking about the physician assistants and most programs, it's really a traditional sort of learning where the professor's in the front of the room they're given a lecture, the students are taking notes, and they go home, and middle of the semester, they get a midterm. That's not really how it's done here. I mean, I don't know if you guys have seen it. When I have the students in the second and third year, and they're coming and they're rounding in the hospital in cardiology, they're really sharp. They're able to think on their feet. They're able to really work through these clinical scenarios. Whereas, if you have someone who is just taking notes, were they really trying to reason through that? I don't really see that. Are we talking about maybe expanding Pearls into the PA program in the future?
I didn't actually think about that, Kareem, but that's not a bad suggestion. We would have to talk to our PA leadership team and see what they thought. So PA programs are a little bit different than nurse practitioner programs. You may or may not be familiar, but that is a 2-year straight-through master's program. And we do have an undergrad program, a dual degree program, so we do take students, for their bachelor's degrees that go directly into the PA program, and people can apply externally to get into that program as well. For a PA program, it will start, in the fall, and then that runs straight through 2 years, through the summers in that full-time program. Their first year is a didactic year, and then their second year is a clinical year. So their second year, they're not even really on campus that often. For the most part, it's almost like a clerkship for medical students or residents. They have, a certain amount of weeks in different specialties, because PAs are generalists. So PAs, once they graduate, they can really work anywhere.
Exactly.
Nurse practitioners are much more specialized. As you know, right, you're picking a specialty and you're focusing on that specialty. And so over the course of your 3-year program, you generally have 4 semesters of clinical experiences whereby you have to, complete a certain amount of hours depending on which program you're in. And then the other time is spent, on campus in the classroom or, some hybrid method perhaps. Can Pearls be added to PA curriculum? It's possible. They do some case-based learning already, and they do use the flipped classroom method. It's just not quite exactly the Pearls pedagogy that we're following like the medical school is following. But in the future, that could be something that we could explore. It's just a question of fitting it in that short time frame that they have for their students.
The first year of the PA program, you said it's more of a didactic thing instead of a clinical. Is that similar to like the 3 Ps, the pathophysiology, physical exam, pharmacology for nurse practitioners?
I think it is similar, but it is different because they are learning all of the 3 Ps. And then some, because they're really getting all of their lectures, all of their demonstrations, on different, clinical procedures and that practice, here on campus. They're all together. It's very interesting. There's 75 students in each class, and they're in a lecture hall together. So, yes, they'll get broken up into groups sometimes for different things, but, they're literally all together all of the time. Those students really become a very cohesive cohort.
So, this is all, incredibly interesting. I mean, I'm learning a lot just talking to you. I think Kareem as well, yeah. Let's take this out into the world of the average citizen, because we're, I guess, mostly talking about the educational side of things. It sort of goes without saying, I guess, that the landscape of healthcare is changing very rapidly, right, in so many ways. So I trained as an MD, as a medical physician, as a surgeon. But now, we have a whole category of provider that didn't exist when I started, which is advanced healthcare providers, which is what we're talking about, right? Nurse practitioners, physician assistants, etc. So for the average person out there, what's going on? People are going out for themselves, take their family to an office visit, to a clinic, to the hospital. Who's taking care of them? How has that changed? Pull out your crystal ball and talk about how you think it's going to continue to change.
So it is absolutely going to continue to change because we don't have enough physicians. We don't even have enough nurses and PAs to take care of everybody that's going to need care, especially as we move into the future. Nurse practitioners have been around since 1978. So, it is a degree, it is a career that has been around for a very long time. And I think what patients need to know about nurse practitioners, because yes, you always hear, well, I want to see the doctor. You have to remember that nurse practitioners were registered nurses before they were nurse practitioners. That is a requirement. So the person who's taking care of you went to school to get a bachelor's degree, had to pass their NCLEX RN boards before they were even eligible to go back to get the advanced degree.
Sorry to interrupt. What is NCLEX?
NCLEX are the boards that the undergraduate nursing students have to take when they graduate in order to receive their license and practice as a registered nurse. Nurse practitioners have had to do all of that, and then they have to go back to school and concentrate in a specialty, complete hundreds of clinical hours before they're able to see a patient independently. And in New York State, we don't quite have full scope of practice for nurse practitioners. So in New York State, for the first 3,600 hours of their practice, they do have to have a collaborating physician. And that collaborating physician, it's not really a supervisor, but it's someone who will do some chart audits, can be there for consultation, for them to be able to talk to about a patient should they need it. After they've completed those 3,600 hours, then they're fully independent. They can, put their shingle out, open up their own office. So, nurse practitioners have a lot of experience. PAs, like I said, that is a super, super intense, highly competitive program. So you're only getting the best and the brightest that are getting admitted into these physician assistant programs. It is very, very concentrated. So like I said, that they have their didactic year where the entire year they're receiving all of their lectures and their didactic learning. And then their next year, that entire year is in the clinical area before they're, able to sit for their boards. And we do have a 100% board passing rate for our nurse practitioners and for our PA students here and our perfusion students.
We're going to keep it that way.
Yes,
right?
we are.
So you mentioned scope of practice, and Kareem and I know what you mean, and maybe some people do. There's probably people that don't.
Yeah.
So I'm going to let you define that. And then I think it's fair to say that scope of practice, which you'll define for us, is a contentious issue.
It is a contentious
between
issue.
the medical establishment, the American Medical Association, and nursing leadership. So why don't maybe sort of take us into that?
In a basic layman's definition, scope of practice is what a provider is legally allowed to do based on the state that they work in. So each state will define, what the practice, there's a Nurse Practice Act for each state that defines, what someone can do depending on their role, right? And it's all different. There's licensed practical nurses, registered nurses, nurse practitioners, physician assistants, medical doctors, and a whole host of other licensed professions that are out there in the state of New York and across the country. And that's really, in a nutshell, what it is, right? It's what you're allowed to do based on the law in the state where you live. However, it becomes a bigger and more political issue than that because it's almost like a turf war. Right. So physicians get concerned that, too many nurse practitioners and PAs are going to, take away from my practice, or, that patients, they'll take our patients, or they're not providing as good a care as us because we're medical doctors.
So there's a bit of ego.
So there
money,
is.
Power.
There's lobbying that, gets involved with different professional organizations, either for or against one or the other. But I think what people have to understand and what the bottom line is, and I think that, even the AMA, American Medical Association, will move towards this in the future, is that there's not enough of us. Right. There's not enough doctors, nurses, NPs, PAs, whatever the case may be. If we talk about nursing in general, there is currently and expected to be a shortage in this country of 78,000 nurses. 78,000, that's a lot of nurses. We lost 100,000 nurses during the COVID pandemic under the age of 35. So people who went to nursing school that wanted to do that and then unfortunately started practicing during a pandemic and then probably got burned out or, said, I don't want to do this. This isn't for me. So we lost 100,000 nurses.
So apply to Hofstra. Right?
Yes. When you read, American Association of Colleges of Nursing, they have statistics and fact sheets that you can look at. There's projected to be a 38% increase in ACPs over the next 10 or so years.
And what is that, ACP?
Advanced clinical providers. Those are our nurse practitioners and our PAs. And even that's probably not going to fix the shortage that there is. Right. One of our programs here is the Family Nurse Practitioner Program. And that's so important because those are primary care providers. That is what we are short of in this country, especially in underserved areas, but just in general, primary care providers. Physicians, right, they also specialize. So, they graduate from medical school and then they have to match with a residency. And so the most highly prized residencies are like dermatology, plastics. Right. It's not family medicine or internal medicine. And those are the providers that we need more of.
And we have, just follow up if you could on that, we have separate tracks, right? We have a family family
So we have
practice,
the family
we
nurse
have
practitioner practice.
psychiatry,
We
and-
have a psychiatric mental health nurse practitioner program. We're always going to need more of those as time goes by because there's just in general not enough psychiatrists in this country. And we have an adult geriatric acute care nurse practitioner program. So those
which
are
is-
nurse practitioners who see patients in the hospital setting.
older patients.
Adults and geriatric patients,
yeah.
yes. Then we have a CRNA program, which is Certified Registered Nurse Anesthetist. Those are the nurses that will intubate you and provide your anesthesia when you are in the OR, or they're the ones that are, right there at the top of your head if you're having a C-section, managing your epidural and your anesthesia. And pain management, yes, a lot of CRNAs will work in outpatient clinics in pain management, and that is a very, very highly competitive program. There are specific qualifications that you have to meet in order to gain entry into that program.
And again, let's toot our own horn here at Hofstra. One of only a few.
Yeah, I'm not sure exactly how many there are
Not
in
too
the
many.
country, but there's under 100. There are
certainly,
not that many CRNA programs.
And not dual degree.
No, we are one of the only dual degree programs. So our students that come here for the CRNA program also become adult geriatric acute care nurse practitioners.
Yeah. What's the ballpark range that we're looking at in terms of enrollment in these programs that we have? Like, what's the spread? What's the ratio?
When we're at full capacity with our undergraduate nurses, we'll have between 400 and 500 undergraduate nursing students.
Wow.
Our PA undergrads we try to accept around the amount that we would accept into the master's program. So about 75 per class. So altogether, that's, 4 years for a bachelor's degree, about 300 undergrad PA students. And then when we move into the master's, it does depend year over year, how many applicants we get for each program. Our goal is about 75 grad students in the NP program. Certainly would love to see more than that. At the moment, we're getting, for the most part, Northwell nurses, but just so everyone knows, even though it is the Hofstra-Northwell School of Nursing and Physician Assistant Studies, it is certainly open to nurses everywhere, and we would love to see nurses from other health systems, both here in New York and across the country, coming to school at Hofstra. So it is not just for Northwell nurses. I'd like to dispel that in case that anyone thought that. Certainly, we'd love to see some nurses from our other local hospitals coming to school here.
Not that there's anything wrong with Northwell nurses.
Of course not. No, we love our Northwell nurses, but our doors are open to everyone.
Yeah, of course. I'm just kidding.
You spoke earlier about the need for more physician assistant and nurse practitioner. We're looking at a job market expansion of maybe 40%. If you think about it also from the patient standpoint, we're dealing with higher acuity patients because people are living longer, so we have to manage these chronic conditions for a lot longer. So it definitely makes sense. How do we bridge that gap? How do we attract people to these programs and also keep in mind the equity, the premium price tag of these programs? How do we reconcile that, these innovative programs with affordability and inclusive access? How do we get more people here?
That is a great question. In terms of affordability, we are a private university, but I think that we are pretty on par with other local private universities. The tuition's pretty similar, and some of those schools also have schools of nursing. I don't think they have PA schools, but schools of nursing, and the tuition's pretty similar between, our two most local private competitors. So, in terms of affordability, there's always scholarships out there for both nurses, physician assistants, perfusion. There's tons and tons of money that we basically leave on the table that could help to pay the cost of tuition for students. So I encourage all students to look professional organizations. Every nursing specialty has their own professional organization. PA has professional organizations, as does perfusion. And so they're always giving money away to students to help to pay for tuition. Applying for, of course, your federal funding, your Pell Grants. We offer scholarships here at Hofstra. So there are different ways that people can, afford to pay for their education.
Northwell helps out.
Northwell, and they have a tuition reimbursement program, as most hospitals do for their employees. So there's lots of different ways that you can pay for your education. I think we can do a better job of helping our students, our future students, finding those scholarships. We actually have a resource link on our website to scholarships, external scholarships that students can apply to.
Sure. And I think also especially these younger students, the ones who are coming straight out of high school, they're just not even aware of what's available out there. They're not aware of certain programs. And I know that, our school has partnered with Uniondale School District, Hempstead School District, and even as far out Longwood School District out east.
Yeah.
I think that that's something as well.
Well, so I think that's something we can talk about a little bit, right, is our pipeline program.
Sure.
And so one of the things that we've done at SONPA and at the School of Medicine also is pipeline programs. And so we bring in high school students, even middle and elementary school students sometimes, to our campus so that they can see what we have to offer. So we give them a tour of the simulation center so that they can see our high-fidelity mannequins. High-fidelity mannequins breathe and have a pulse, and, they're super cool, and they blink, and the babies flail, and so there's lots of different things that they do. And so we like to show students these things because that's what really sparks their interest. I had a colleague, and you hear the saying all the time, right? That's what ignites the spirit of inquiry. They see that, and they're like, oh, that's interesting. I want to do that. And you watch it when we have them come in for tours, or even when they come with their parents or the guidance counselors, their eyes light up because it makes it so much more real for them, and it's a really much more immersive learning experience.
A little bit of Disneyland, right?
Yeah.
So, Kristy, if anyone wanted to access information about the program, where would they go to get that information?
You can access that on the Hofstra.edu website. When you get to the website, if you navigate to academics and you choose the School of Nursing and Physician Assistant Studies, it will open up our webpage where you will see information about all of the programs that we have to offer, contact phone numbers in case you want to speak to someone to get some more information, as well as how to apply.
So, wow, this has been great. Really, I think both Kareem and myself, I'll speak for him, but I think it's fair to say we both learned a lot. I'm sure our audience did as well. And like I said before, we're going to definitely have you back.
Okay.
To talk about the world of mental health.
Absolutely.
And we'll definitely talk about this simulation.
Okay.
All right. So with that, this has been a production of Nurse to Health, brought to you from the studios of WRHU at Hofstra University in collaboration with the Hofstra-Northwell School of Nursing and Physician Assistant Studies. For my co-host, Dr. Kareem Nagdala, and myself, Dr. Bob Gluck, stay well, and thank you for tuning in to another episode of Nurse to Health.